When it comes to a bump on the head or a more serious injury during sports, would you know how to spot a concussion and how to treat one? This next Ask the Medical Expert segment has been sponsored by Arch Neurosurgery. And joining us this afternoon is Dr. Joseph Yazdi. Dr. Yazdi, thank you so much for being here with us today.
My pleasure. Thank you for having me.
Absolutely. And you're with Arch Neurosurgery. Tell us a little bit more about what you do at Arch Neurosurgery.
So one of the things that I do, I'm a board certified neurosurgeon. One of the things that I do is treat people with concussion. Now, you ask me what's a concussion. Concussion is a part of a bigger picture called traumatic brain injury. It comes in 3 different categories: mild, moderate, and severe. The mild category is called concussion. And it's so common that it itself is also broken down into 3 categories: mild, moderate, and severe, depending on the severity of your symptoms at the time of the accident.
Well, thank you for breaking that down for me. I didn't know there were different levels to a concussion. I mean, what are some of those main symptoms of a concussion that people experience if they have one?
So if you look at that sheet, a lot of them define different parts of the body are going to get injured differently. Different parts of the brain are going to get injured differently. So we're looking at headaches, neck pain. We're looking at light and noise sensitivity, speech issues such as slurred speech or pauses, stuttering, memory and concentration, and also a lot of psychiatric issues such as anxiety, depression, being a lot more emotional, like crying for no reason, or also what I call situational PTSD, which is when in the same situation and when the accident happened, you get sweaty, clammy, heart racing, just feeling of scared, you know?
You mentioned a lot of these symptoms, and a lot of these symptoms are scary if you are experiencing a concussion. I mean, how is it diagnosed for sure to know that you actually have one?
Well, a lot of times people get clued to it based on family members or relatives or even teachers, but really you need to come to a specialist. In my case, I do special kinds of testing, both in my office and also I send them out for other specialized testing. One of them is called DTI MRI, done over at Reyes. There's very few of them that do it in the city. Reyes is one of them that does it and does a really great job. So I get really good pictures so I can get a good analysis and understand what's going on. Depending on what that test shows me is all the deep stuff inside the brain, the tracts that have been injured, and put that together with my test, and I can see the extensive amount of injury that's been done to the brain. Put them all together, you come up with a good idea of the severity of the concussion, and you can go about treatment.
Nice. And speaking of treatment, how do we treat a concussion?
Okay. Well, believe it or not, 30 years ago when I first started medicine, it used to be like, hey, go home, sleep for 2 weeks, come back, and you should be fine. And we know that's really far from the truth. You get a lot of symptoms that are lasting. Headaches, the main ones are headaches, memory issues, and all the psych issues. So I do a multi-pronged approach to this treatment, to this problem. A lot of it is done in my office by myself. For example, when it comes to headaches, sometimes you need medication, but a lot of times you need injections. Instead of sending to another specialist, I do it in my office. Stress management. Try and have them learn how to do relaxation techniques, how to be organized, because memory is a big problem, how to be organized with your phone, because everybody carries a phone. You need to know how to use it effectively. Medications for their anxiety, depression, and PTSD. I do that myself instead of sending them to somebody else. All these things that I do in my office saves them multiple trips and a lot of stresses, and that way they can combine everything in one place. TMS is a very big thing for me right now. TMS is a company where they can, using magnetic field, realign all those tracks inside the brain that have been disturbed by the injury. So you get the ringing in the ear where there's no other treatment except for TMS. Sometimes headaches, insomnia, all those things, including memory, get better with their treatment, plus all the things that I do in the office with me. So we do pain management, psych, neuro, in my office, kind of.
Covering all your bases, right?
Covered in the office, because the whole point is to not have the patients go all over the place.
It's everything done right here.
And then the TMS.
In-depth analysis, in-depth diagnosis, and in-depth treatment. Arch Neurosurgery is taking care of you from start to finish. If you are experiencing some traumatic brain injury or a concussion, go ahead and lock them into your phone. It's Arch Neurosurgery. You can visit them online at archneurosurgery.com. You can also follow them on Facebook and on Instagram. They're located on South Brentwood Boulevard. We'll make sure you have access to all of their details on our website at studiostl.tv. Dr. Yazdi, thank you so much for joining us in St. Louis. Don't go anywhere. We'll be right back after this quick break.